Hello, Dr.WD here. Today we'll be preparing the caramelized clavicle. Today I will be explaining only step 1 and 2. The further steps will be in the coming videos. So let's begin with step 1, gather in the ingredients. We can see here the clavicle with the superior aspect. The superior aspect of the clavicle with the sternal or medial end, the lateral or acromial end, and the shaft. Also we can see the inferior aspect with the sternal and medial end, the lateral and acromial end, and the shaft with all of the same parts in both the superior and inferior aspects. So now we can move on to step 2, preparing the characteristics. The first characteristic is that clavicle translates to a small key in Latin. But why is that so? Do we have a small key in our body? What is the secret behind this? There are two reasons for this. The slight S-shaped curve of the clavicle makes it look similar to an ancient Roman latch key. Now I have a diagram here, and we can see that the clavicle in somewhat sense is similar we can see here that it's somewhat similar to a key. It gives, like, it's not an exact replica, but it's very similar. Now the next reason, when the arm is moved or my pen has seemed to moved. When the arm is moved or specifically raised above one's head, the clavicle rotates on its axis. This motion is similar to that of a key turning in a lock. So to the addition of it looking similar to a key, its motion is also similar to a key. Next characteristic is that it is 15 centimeter or 6 inches in length. So we can see here that the clavicle is 15 centimeters or 6 inches in length. That is very simple. Now that just seems like, a characteristic. Why would it have a reason? But there are two reasons to this. It is this length to act as a strut holding the shoulder joint at a proper distance. If it were shorter, the shoulders would collapse into the chest, and if it were longer, the shoulders would have lost mechanical stability. So this length is the proper it should be. Now then, it may be a little shorter or a longer depending on the person's physique, but this is an average which is considered usually. This particular length provides the scapula the perfect space to glide smoothly across the back, allowing humans to swing their arms easily. It helps us rotate our arms easily. Now the next characteristic is that it has a slight S-shaped curve. That also seems like it's just there. Why would it have a reason? But in anatomy, everything has a reason. There are 3 reasons, or there are 4 reasons for this. First reason, the curve acts as a spring When a human falls on an outstretched hand, the clavicle bends to absorb and distribute the force. This successfully prevents the clavicle from fracturing under pressure. Now we can see here in the diagram that it has been said that this clavicle acts as a spring and bends somewhat, I'd say, like this, and distributes the force and does not thankfully break, but although this bone is the most common to fractures. The next reason is that the curve forms a protective archway. For the crucial nerves, which is the brachial plexus and blood vessels, the subclavian vessels passing from the neck to the arm. And I have a diagram of which somewhat gives us an idea of how the brachial plexus and the subclavian vessels look like. Here we can see the brachial plexus. This is not an exact depiction, but it gives an idea. Here we can see the I feel the app is glitching a bit. We can see the brachial plexus. This is not the exact number of nerves or the exact path it travels in, but it gives an idea of the nerves traveling from the neck to the arm. And the subclavian vessels, the same goes for this. This is not exact, it just gives us an idea, a depiction, not an exact, but since this is just an introductory video to the clavicle, we get an idea of what it could look like. Reason number C. The curve helps the clavicle keep the scapula The curve helps the clavicle keep the scapula and arm free from the torso, providing the arm a massive range of motion without bumping into the rib cage. So this curve keeps the arm at a proper position such that the scapula and arm are away and do not bump into the rib cage constantly. Hence, you can try moving your arm right now, it will not bump into the rib cage. This is because of this curve. The next point is that the curve provides a large surface area for bone attachments such as major muscles, including the pectoralis major muscle, deltoid, trapezius, and sternocleidomastoid. So first we will see the pectoralis major. We can see the pectoralis major muscle right here of how it is attached to the clavicle about here. This is not an exact drawing, but we do get an idea of how the pectoralis major muscle is. The next is the deltoid muscle on the shoulder. This dark red here means that the muscle is in front on the shoulder, and this highlighted red means this muscle is on the back. since I do not have a way of showing 3D diagrams, this is my way of depicting a muscle. If the red is dark and pure like this, then the muscle is in front, and if it's highlighted like this, then the muscle is present on the back, and this is how the deltoid muscle is. Next we have the trapezius muscle. This muscle is absolutely present on the back. Oh wait, I did not show you one thing. We can see how the muscle here is attached to the clavicle, and the next trapezius muscle is, we can see that it's attached to the clavicle right about here, and it's wholly present on the back. Next would be the sternocleidomastoid. It's present practically in the neck, and we can see that this part is present on the front and this in the back, joined to the skull, and it is joined right here on the clavicle. Characteristic number 4, it is located horizontally on the anterior side of the body. Now this might seem like, this also is like, it might seem that it's just a characteristic, why would it have a reason? But as you can see, there are 4 reasons behind it. The horizontal spacing prevents the shoulders from collapsing into the chest. This is the result of this horizontal placement. So if this horizontal placement was not of the clavicle, if the clavicle was not present horizontally, the shoulders would collapse into the chest. This horizontal placement is providing the proper spacing to prevent the shoulders from collapsing into the chest. Second, the clavicle is the only attachment between the upper limb and torso from the arm to the sternum. The anterior position helps keep balance due to the heavy muscular forces pulling from the back. We can see that the clavicle right here, the clavicle is the only attachment from the arm to the sternum, only bony attachment between the arm and the sternum. The scapula might seem like it's present, but it is practically floating in the back. It is not joined to any bone except over here. So this so the clavicle right here is the only bony attachment from the sternum to the arm, and hence this, if it were vertical, if the clavicle were vertical or any other position, it would not work out, because this horizontal position is keeping balance as the muscles from the back pull it. This horizontal placement keeps the shoulders facing outwards, allowing the human arm to rotate properly. So this horizontal placement is keeping the shoulder away from the body in such a position that the arm rotates properly. And this anterior placement creates a protective archway for major nerves and blood vessel, which is the brachial plexus as seen here, and the subclavian vessels. All this also here, this is not a proper exact replica, but a depiction of what the brachial plexus and subclavian vessels look like going from underneath the clavicle. The next characteristics is that its lateral end is flat while the medial end is large and quadrilateral. Why is that so? There are many reasons for it. As you can see here, there are 4. The flat lateral end, my pen is glitching a lot, or the app, I'm not sure. The flat lateral end articulates with articulates with the flat acromion process of the scapula, allowing the bone to slide, rotate smoothly when the shoulders move. So here we can see that this lateral end articulates over here. The lateral end articulates with the acromion process, and hence they sit properly. They can glide on each other smoothly. The flattened, expanded surface provides a wide, stable area for tough ligaments. The flattened, expanded surface provides a stable area for tough ligaments, which is the coracoclavicular ligament, to bind the clavicle firmly to the shoulder blade. You can see here that this is the coracoclavicular ligament, and it helps the clavicle properly binded to the shoulder joint. The quadrilateral end is bulky as it connects to the sternum with the entire weight of the upper limb, hence needing a larger surface to distribute heavy mechanical stress. The large quadrilateral end has a thick fibrocartilage disc which absorbs force transmitted from the arm before reaching the axial skeleton. It has a shaft, the S-shaped curve, two ends, lateral and acromial, and medial and sternal. There are also reasons for this. 3. The medial end articulates with the sternum, bearing the weight of the entire arm, while the lateral end articulates with the scapula, holding the shoulder joint together, allowing smooth movements. The shaft acts as a mechanical lever, increasing the range of motion for the arm as well as providing a large surface area for the chest, neck, and shoulder muscles to attach. The shaft is slightly curved. It is convex forward in its medial 2/3 and concave forwards in its lateral 1/3. So first we will see where this is. We can see that this, in the superior aspect, this seems to be this pen is glitching a lot today. Just a minute. This seems to be the lateral, this seems to be the medial 2/3, which is convex forwards, and this seems nothing at all. It's fine. It's fine. You can see, right, what I'm trying to say. This seems to be the lateral 1/3, which is concave inwards, and this seems to be the medial 2/3, which is convex forward. Also, in the inferior aspect, this seems to be the convex forward medial 2/3, and this seems to be the inferior lateral 1/3, which is concave forwards. The medial 2/3 concave forward creates a protective archway for the vital brachial plexus and the subclavian vessels. This prevents the bone from pinching or crushing the nerves and vessels. The lateral 1/3 concave forward positions the clavicle to meet the acromion process of the scapula perfectly. This keeps the shoulder joint properly aligned and oriented. So here we can see that this convex forward is creating an archway for the brachial plexus to pass without the bone pinching it. Same goes for the subclavian vessels. The medial 2/3 convex forward expands the surface area for the attachment of heavy pectoralis major muscle of the chest and the sternocleidomastoid muscles of the neck. The lateral 1/3 concave forward provides the proper angle for the trapezius and deltoid muscles to attach. The curved shape acts like a spring. It absorbs and transmits force from the upper limb to the axial skeleton on impact. If the clavicle was straight, it would snap immediately under pressure. Here we can see that the pectoralis major muscle is attached to the lateral medial 2/3 convex forward, while as well as the sternocleidomastoid is also attached to the medial 2/3 convex forward of the clavicle. And here we can see that the trapezius muscle is attached to the clavicle's lateral 1/3 concave forwards, as well as over here we can see that the deltoid muscle is attached to the clavicle's lateral 1/3 concave forward. Now we are here at the second last characteristics. The inferior surface is grooved longitudinally in its middle 1/3. The groove acts as an anchoring site, providing security to the subclavius muscle. The subclavius muscle's function is to pull the clavicle downward and stabilize the shoulder girdle during motion. This groove acts as a protective channel, tucking away the subclavian muscle neatly. This muscle is present between the hard bone and fragile subclavian vessels and brachial plexus. Hence, the subclavian muscle acts as a cushion between them, providing protection. So the subclavian vessel is present right here between the bone and the brachial plexus, as well as the subclavian vessels, providing a cushion. And the last characteristic is that it articulates medially with the sternum and laterally with the acromion process of the scapula. The clavicle articulates with the sternum medially, creating a rock-solid pivot joint called the sternoclavicular joint. It anchors the entire weight of the upper limb to the axial skeleton. It articulates with the acromion process of the scapula, forming the acromioclavicular joint that locks the clavicle to the scapula. Hence, as a result, they work as one single unit. This lateral and medial connection helps the clavicle act like a crane. It uses the sternum as a stable platform to keep the shoulder pushed outwards, hence allowing the arm to move freely without crashing into the rib cage. So here we can see that this is the sternoclavicular joint. This right here is the sternoclavicular joint. It bears the weight of the whole upper limb, and this is the acromioclavicular joint. It keeps the shoulder girdle together. Now we are done with both the steps, and I'd like to show you some attachment sites on the clavicle, which we have already studied, but I will give you a proper depiction as well. This is the superior aspect of the clavicle, and right over here, the red part is the attachment site of the trapezius muscle, which is on the posterior side of the clavicle, and on the lateral 1/3, while the yellow part marked here is the attachment site of the deltoid muscle, which is on the anterior side of the lateral 1/3 of the clavicle, and the pink or purplish looking highlighter or color is the attachment site of the pectoralis major muscle, which is on the anterior medial 2/3 of the clavicle, and the orange looking color is the attachment site of the sternocleidomastoid muscle, which is not specifically very it is on top of the clavicle on the lateral 2/3. Now we can see the inferior aspect of the clavicle. Over here we have lots of attachment sites. The yellow color is the attachment site for the deltoid muscle. The pink or purplish looking color is the attachment site for the pectoralis major muscle. The deltoid muscle is obviously, as said before, on the anterior side of the lateral 1/3 of the clavicle, and the pectoralis major muscle is on the anterior as well, on the lateral medial 2/3 of the clavicle. The this color right here, this color is the trapezoid part of the coracoclavicular ligament. The coracoclavicular ligament is made up of two parts, trapezoid and conoid, one of which is this present right here, while this is the conoid part. The next right here is the attachment site for the trapezius muscle. While this in green is the attachment site of the subclavius muscle, and the pink color over here is the attachment site of the costoclavicular ligament, as well as something extra which we have already studied, but I have written it here separately. This is the superior aspect of the clavicle, while this is the capsule of the sternoclavicular joint. This is the part which joins to the sternum to form the sternoclavicular joint, and this is the capsule of the acromioclavicular joint. This part joins with the acromion process of the scapula to form the acromioclavicular joint. The same goes for the inferior aspect. This is the part which joins with the sternum to form the sternoclavicular joint, while this is the part that joins with the acromion process of the clavicle of the scapula, to form the acromioclavicular joint. This is all for the first video. Here we have studied the clavicle's two steps, the ingredients, which is the parts of the clavicle, and the characteristics of the clavicle. Further on we will be explaining the peculiarities and features, etc. That is all. This is Dr. WD signing out. Goodbye.